नमस्कार। मैं अभी अपने सभी दर्शकों का स्वागत करती हूँ हमारे आज के 14वें संस्करण में, हमारे इस प्रोग्राम में जिसका नाम है आपका विश्वास हमारा प्रयास। और जैसा कि हमारे प्रोग्राम का नाम बताता है, क्योंकि हमारे जो विद्यार्थी हैं और जो भावी विद्यार्थी हैं, उन्हें विश्वास है कि इग्नू उन तक सभी ऐसे पाठ्यक्रम लेके आएगा जो उनकी उन्नति में सहायक होंगे। इसीलिए उस विश्वास को पूरा करने के लिए हम निरंतर प्रयास में लगे रहते हैं। और उसी कड़ी में आज हम आपके सामने लेकर आए हैं हमारे स्कूल ऑफ एग्रीकल्चर को। सो लेट मी इंट्रोड्यूस टू आवर व्यूअर्स द पैनल ऑफ एक्सपर्ट्स टुडे. Namaskar.
Namaskar.
We have with us today Dr. Praveen Kumar Jain, who is the Director of School of Agriculture, and Dr. Meeta, who is the Associate Professor in the School of Agriculture. And with the help of the information that I think is going to be valuable for our learners, we will try and see whatever information we can provide to our learners. Also, I would like to add that there are certain numbers that you would be seeing scrolling on the bottom of your screen. If you have any questions or queries with regard to any aspects of the details or information being provided in the program, please feel free to connect with us on those numbers. तो इसी के साथ हम कार्यक्रम की शुरुआत करते हैं। स्वागत है आपका डॉक्टर जैन। सबसे पहले मैं ये जानना चाहूँगी आपसे कि जो हमारा स्कूल ऑफ एग्रीकल्चर है वो इग्नू की हिस्ट्री में काफ़ी देर में आया। तो मेरे ख्याल से 2005 में इस्टेब्लिश हुआ और अभी 18 साल होने जा रहे हैं। तो ये किस विज़न, किस मिशन के साथ स्कूल इस्टेब्लिश हुआ, थोड़ा इस पे प्रकाश डालिए प्लीज़।
धन्यवाद। जैसा कि आपने बोला कि स्कूल ऑफ एग्रीकल्चर 2005 में बना, और जो इस स्कूल का जो बनाने के पीछे जो मिशन था वो मानव संसाधन में सुधार करना, साथ ही साथ जो एग्रीकल्चर सेक्टर की प्रोडक्टिविटी है उसको कंटिन्यू करना, उसमें इम्प्रूवमेंट करना। ये हमारा एक मिशन के साथ हमने स्कूल ऑफ एग्रीकल्चर बनाया है इग्नू में। और एक्चुअली इसके पीछे विजन ये है कि जो जो हमारा ओडीएल सिस्टम, ओपन एंड डिस्टेंस लर्निंग सिस्टम है, हमारा कन्वेंशनल सिस्टम है, जो एजुकेशन सिस्टम है, उनको किस तरह से हम हार्नेस कर सके ताकि जो एग्रीकल्चर सेक्टर की प्रोडक्टिविटी को इम्प्रूव कर सके, उनमें सुधार कर सके। ये एक हमारा बेसिक एक मिशन एंड विजन था। और इसके लिए हमने जो स्कूल ऑफ एग्रीकल्चर के लिए बेसिकली 2-3 मुख्य उद्देश्य निर्धारित किए। पहला उद्देश्य हमने निर्धारित किया कि मानव संसाधन जो ह्यूमन रिसोर्सेज है एग्रीकल्चर में और एलाइड सेक्टर में। एग्रीकल्चर में हम एक बहुत ही विस्तृत क्षेत्र है, वहाँ फसलों की बात होती है, फल उद्यानों की बात होती है, सब्जियों की बात होती है, साथ ही साथ दुग्ध जो उत्पादन है उसकी बात होती है, खाद्यान्न प्रसंस्करण की बात होती है। तो बहुत सारे सेरिकल्चर भी आता है, पोल्ट्री फार्मिंग भी आता है, बी कीपिंग भी आता है। तो एक विस्तृत क्षेत्र होता है एग्रीकल्चर। तो एग्रीकल्चर सेक्टर में और जो एलाइड सेक्टर है उनके लिए मानव संसाधन को कैसे विकसित किया जाए, एक मुख्य उद्देश्य है। दूसरा उद्देश्य हमने स्कूल ऑफ एग्रीकल्चर में ये बनाया, जो हमारे फार फ्लंग एरिया, जो दूरस्थ स्थान है या पहाड़ी क्षेत्र है या हम नॉर्थ ईस्ट के स्थान है या रूरल एरिया है, वहाँ पर कन्वेंशनल एजुकेशन सिस्टम अवेलेबल नहीं है, वहाँ पर एग्रीकल्चर एजुकेशन को पहुँचाया जाए। तो एक दूसरा उद्देश्य। तीसरा उद्देश्य हमने स्कूल ऑफ एग्रीकल्चर में बनाया है कि जो इस एग्रीकल्चर सेक्टर के और एलाइड सेक्टर के लिए जो नॉलेज की आवश्यकता होती है, जो स्किल की आवश्यकता है, उनको हम उनको दे सकें। जो हमारे जो ग्रामीण क्षेत्र के लोग हैं, जो कृषि क्षेत्र में कार्य कर रहे हैं या कृषि से आधारित उद्योग धंधों में काम कर रहे हैं, उनको हम जो नॉलेज और स्किल की ज़रूरत है उनको हम पहुंचा सकें। ये इसका हमारा उद्देश्य था।
जी बिल्कुल। तो क्योंकि एग्रीकल्चर एक ऐसा फील्ड है जिसमें एक प्रैक्टिकल कंपोनेंट है, जो विद्यार्थी हैं वो कार्य करके सीखते हैं। तो मेरे ख़्याल से हमारे जो लर्नर्स हैं ये ज़रूर जानना चाहेंगे कि ओडीएल मोड में जब ये सीखते हैं तो क्या प्रोसेस है, किस तरीके से वो सीखते हैं कि ओडीएल के थ्रू उनको जो मटेरियल मिलता है, जो जुड़े हैं जिन्होंने कोई सर्टिफिकेट या डिप्लोमा प्रोग्राम किया हमारे यहाँ से, उनको तो दिक्कत नहीं होगी, वो समझ जाएंगे, लेकिन क्योंकि उनको सिस्टम मालूम है। लेकिन जो पहली बार शायद जुड़ने का प्रयास करेंगे, उनकी क्लैरिटी के लिए आई थिंक ये बताना बहुत ज़रूरी है कि जो प्रैक्टिकल कंपोनेंट है एग्रीकल्चर के सारे प्रोग्राम्स में, उसको किस तरह से विद्यार्थी एड्रेस कर पाएंगे या कैसे पा सकेंगे वो कंपोनेंट से शिक्षा।
जैसे कि मैंने बताया कि हमारा उद्देश्य भी है नॉलेज और स्किल, ज्ञान की हम देना चाहते हैं, साथ ही साथ स्किल देना चाहते हैं। और एग्रीकल्चर की सब्जेक्ट की जब बात करते हैं तो हमेशा एक प्रैक्टिकल कंपोनेंट होता है, और प्रैक्टिकल कंपोनेंट बहुत ही ज़्यादा होता है। तो इसके लिए बहुत ही एक सिस्टमेटिक एक मेथड है और सिस्टम है ओडीएल एंड डिस्टेंस एजुकेशन के थ्रू, जिसके थ्रू हम शिक्षा देते हैं। उसमें हम क्या करते हैं कि पूरे इंडिया में, पूरे भारत देश में हम देखेंगे कि बहुत सारे संस्थान हैं जो एग्रीकल्चर से रिलेटेड हैं या एग्रीकल्चर सेक्टर में काम करते हैं। उनमें से कुछ चुनिंदा संस्थान हैं, कॉलेज है या सेंटर है, ट्रेनिंग सेंटर है, कृषि विज्ञान केंद्र है या कृषि अनुसंधान केंद्र, उनको हम एक स्टडी सेंटर बनाते हैं। तो उन स्टडी सेंटर में हम क्या करते हैं, प्रैक्टिकल की फैसिलिटी देते हैं। वहाँ पे स्टूडेंट्स आते हैं, प्रैक्टिकल करते हैं, और जनरली हम प्रैक्टिकल का एक शेड्यूल इस तरह से बनाते हैं कि वो सैटरडे संडे जो छुट्टी का दिन होता है, वहाँ पर आके वो अपने प्रैक्टिकल जो भी प्रोग्राम स्पेसिफिक हैं, जैसे पोल्ट्री फार्मिंग का अलग से प्रैक्टिकल शेड्यूल है, या बी कीपिंग का अलग से होगा, ऑर्गेनिक फार्मिंग का अलग से होगा, जो भी डेयरी टेक्नोलॉजी का अलग तरह का स्टडी सेंटर होगा। तो प्रोग्राम की आवश्यकता के अनुसार जो हमारे एजुकेशनल प्रोग्राम स्कूल ऑफ एग्रीकल्चर में 15-16 प्रोग्राम है, उनकी आवश्यकता के अनुसार उनकी जो रिक्वायरमेंट है, उनकी स्पेसिफिक रिक्वायरमेंट को देखते हैं हम स्टडी सेंटर बनाते हैं। वहाँ स्टूडेंट्स जाते हैं, प्रैक्टिकल करते हैं। वहाँ पर थ्योरी काउंसलिंग भी होती है और प्रैक्टिकल काउंसलिंग भी होती है। और प्रैक्टिकल काउंसलिंग में स्टूडेंट्स को अटेंड करना जरूरत है, तो उसमें एक कंपलसरी कंपोनेंट रखा है कि 75% अटेंडेंस वहाँ स्टूडेंट्स की बहुत ज़रूरी होगी, ताकि वो कोई पार्ट मिस नहीं कर सके।
बिल्कुल बिल्कुल। तो ये बताना ज़रूरी था इससे पहले कि हम अपने विद्यार्थियों या भावी विद्यार्थियों को आगे ले चलें और स्कूल ऑफ एग्रीकल्चर के सारे प्रोग्राम्स के बारे में बताएं। ये बताना ज़रूरी था ताकि वो ये ध्यान में रख लें कि ओडीएल मोड का मतलब ये नहीं है कि आप घर बैठे हर चीज़ सीखेंगे। आप तक शिक्षा हम पहुंचाएंगे, लेकिन जो प्रैक्टिकल कंपोनेंट हैं, जो एसेंशियल एस्पेक्ट्स हैं, उसके लिए आपको भी अपने जो भी बताए गए स्टडी सेंटर्स हैं वहाँ जाना पड़ेगा, और इसीलिए अटेंडेंस की जो रिक्वायरमेंट है, जैसा कि डॉक्टर जैन ने अभी बताया, उसको अडहियर करना होगा। तो अब हम मेरे ख्याल से अपने जो प्रोग्राम्स हैं स्कूल ऑफ एग्रीकल्चर के, उनके बारे में हमारे लिसनर्स को बता देते हैं, हमारे व्यूअर्स को। डॉक्टर मीता, सबसे पहले हम मास्टर्स प्रोग्राम से शुरुआत करते हैं, तो क्यों ना आप हमारे व्यूअर्स को बताएं जो हमारा स्कूल ऑफ एग्रीकल्चर का मास्टर्स ऑफ साइंस प्रोग्राम है, उसके बारे में प्लीज़।
Sure, ma'am. I'll be very happy to share the information about our master's program. Actually, we have launched the program in last year, the July session, 2022 July session for the first time, MSc in Food Safety and Quality Management program. Earlier, we used to have our PG diploma in the same subject, PG diploma in Food Safety and Quality Management program, that was on offer since 2009 or 10. So last year, July session, we offered MSc, this new program, and this is actually the program that is the upgradation of the existing PG diploma program, and this program is having multiple entry and exit options. So a student who takes admission in master's program, after completion of first year of the master, they can exit the program with a PG diploma, that is PG diploma in Food Safety and Quality Management. And even the students who have already completed PG diploma earlier, PGDFSQM program earlier, that person can take admission directly into the second year of the MSc.
राइट, ओके। सो ये तो हमारा वो मॉड्यूलर कंपोनेंट हो गया प्रोग्राम का। तो ये भी बहुत अच्छी चीज़ है, considering that a student might register for a program but may not, for whatever reasons, be able to see it through. It is not as if whatever time the student puts into the program is going waste.
Yes.
there is always a takeaway from whatever time the student puts into the program. That is something that is of immense value, and we always stress this in each of our episodes for all our listeners, that when you enroll for a program in IGNOU, there are always issues that the university preempts and keeps into consideration, considering that we cater to a large section of students who are probably in need of flexibility of time. Um, Taking ahead from here, Dr. Mita, there are some other advanced diploma programs as well, I believe.
Yeah, we have PG diploma program, PG diploma in food safety and quality management.
Yes,
And there is another PG diploma, that is PG diploma in agribusiness.
yes.
We have PG certificate also, PG certificate in agriculture policy program. So PG level, we are having these programs only.
Right.
Others are actually undergraduate diploma programs. We're having in the area of foods processing, like dairy technology, meat technology, fruits and vegetables technology. Then we have program in watershed management, horticulture diploma.
So, they seem to be quite interesting and exciting programs, but for the value of our listeners and viewers' understanding, I would like you to give a certain an explanation in terms of what would be the contemporary or future relevance of these programs for the viewers, because if a student wants to take admission, a clear idea as to what the student is probably looking forward to will give them a certain understanding.
Okay, sure, ma'am. So I'll first start with the MSc program, that is MSc in Food Safety and Quality Management.
Yeah.
That is very relevant one. Actually, the food safety and quality management, this is an emerging discipline. Earlier, we used to have conventional system in educational program like a graduation, post-graduation in food science and technology, food science and nutrition, food processing technology.
Right.
But there was no such program which is specifically only meant for the food safety and quality management.
Right.
So very recently in India, actually, we have started offering this kind of program. Earlier, we used to have a certificate and diploma level program. Now, a few other universities have also started master's level program in food safety and quality management, as well as IGNOU also we have started. So the importance of this program is kind of, if you heard about the Food Safety and Standards Act, which came in 2006, that is very important one. All the food business operators in our country, whether it is small street food vendors or the big food industries, everyone has to comply with the requirement of the Food Safety and Standards Act. And as per that act, there are a number of regulations, more than 25 regulations are there. Everyone has to comply with. And food safety is important for all of us. As a consumer of food, even we need to ensure that the food is safe for our health. Absolutely. Right? So for ensuring the quality and safety of the food, all the food industry, food business, they have to ensure the quality. They need to have the trained, skilled personnel, professional who can ensure the quality of the food. So everyone involved, starting from the production of the food, whether it is a plant products or animal products, then processing, packaging, retail, distribution, till the consumption, each step we need to ensure the quality. So there is requirement for the professionals in our country, in the food industry and business, who are who are selling food in the country or importing or exporting. Everyone needs to have professionals. And through this kind of educational program, PG diploma or master's program, we will be able to develop the human resources which are needed for this very specific purpose of ensuring the food safety and quality. So I would say that this program is very much relevant, and the students will have very good scope for their employment in the food industries, food training center, testing centers, and academic institutes.
So, are some of these programs recent additions into the curriculum, or the basket of courses programs that the school is offering?
Yeah. There are 3 new programs the school started last year or last to last year. One is that MSc in Food Safety and Quality Management. Another one is PG Diploma in Agribusiness. Another one is Diploma in Horticulture.
Okay.
Before that, we used to have a number of certificate and diploma programs, but last year we have started these ones.
Right. So, what would you say is the profile of the learners that try to look at enrolling in these programs? Maybe I should ask Dr. Jain to address that.
Yeah, the profile of our learners are very specific, because our programs are targeted to a specific clientele groups, like diploma in poultry farming. It is targeted to the peri-urban areas, where the scope of poultry is there, egg or meat is there. And like if you diploma in horticulture, it is targeted towards the, again, if you grow the vegetables, the peri-urban area is the target group. So because our programs are relevant to a specific local needs, where there is a requirement, a scope is there, in some Punjab or Gujarat, you will find the scope of the milk processing is there. So diploma in dairy technology, they are targeted towards a specific skills which create the employment. So our relevance, you ask the question about the relevance of the program.
Ji.
So our programs are relevant because they are targeted, they have the objective to build the skills, so create the pools of employer, not just seeking the job, but we want to create the persons who can give the jobs to the others. So that is the
Right.
target. And so that's why the variety of pupils join the School of Agriculture programs, people from the rural areas who want to earn something, so they can go for the certificate in beekeeping, they can go for the organic farming, or the semi-urban areas who can set up the industry or entrepreneurship in agriculture. They can go for diploma in value-added products from fruits and vegetables. They can go for diploma in dairy technology, diploma in meat technology, or the persons basically who are already working in the field, or they want to build their further skills upgradation. So they can go the food safety programs, like, or they can go the PG certificate in agriculture, or recently started our PG diploma in agribusiness, who are already working in the industry, or the graduate who want to go for the agribusiness area. So profile is very vast, but we are targeting very specific kind of the learners.
Right. I'm after listening to that, I'm rather curious. Um, are there a large number of, I mean, the proportion of women students, is it large, or do you have mostly men or male students?
Yeah, you can say 50-50.
Okay, that's
Both
very good.
both type of women is also there, and
Right.
the because in agriculture, particularly when we go to dairy sector
Hmm.
or food processing, so women are working in this areas.
Right.
Yeah, small poultry management or more poultry farm, the women are working. So there's a both both the genders are there.
So they do look forward to enhance their skills in a systematic manner and then get into the business.
Yeah,
That's a wonderful thing to learn. I think we would also, I think we'll move ahead to some of the other programs that the school is offering. While you're telling us about this, Dr. Jain, why don't you share with us some other programs that the school is
Yeah,
offering apart from
Dr.
what
Mehta said
Dr.
that
Mehta said?
we have recently started the PG diploma in agribusiness.
Ji.
This is the very new and innovative programs of 1 year duration. And basically, the agriculture is changing a lot over the period. Last 20 years, you will see the farmers always look, in the market before going for the crops. So, agriculture is not just growing for the family, but agriculture is to earn for the family.
Right.
So income is the major criteria nowadays, and the farmers want more profit out of agriculture business. So so agriculture has become, it's becoming a business rather than activities, regular activity. So in that manner, we have to see the agriculture sectors, and there are the methods of cultivation of crops is also changing. There is a lot of advancement. Farmers are using the high cost inputs, so that they can produce more, or they are also focusing on the quality aspect. So agriculture sector is, we have to it like a business sectors, so they also need the management professional, particularly on the food processing sector or marketing sectors or finance management sector. So keeping such requirement, the School of Agriculture started the PG diploma in agribusiness, and in this program basically we have covered all aspects of business management which are relevant to the agriculture sector, like marketing, human resource management, even the business organizational behavior, use of digital technology in agribusiness management, the agribusiness management policies, business laws, all aspects are there. Or and also we have also included the research methodology, the how to analyze the project if a persons or a learner develop the new project for setting up the industry, how to analyze that project, so all aspects we have covered in this program. And after completing this programs, the students can go for the agro-based industries like input industry, seed industry, fertilizer industry, pesticide industry there. And then the supplying of the uh, agriculture produce to the market retail chain, they can go. And
Right.
then they can go for the of course in the marketing. So there is a wide scope is there after completing of these programs, and lot of job opportunities also there in this program.
बिल्कुल। और साथ ही साथ हम अपने दर्शकों को ये भी बताते चलें कि ये जो भी प्रोग्राम्स जिनके बारे में हम आज के एपिसोड में आपको जानकारी दे रहे हैं स्कूल ऑफ एग्रीकल्चर के द्वारा, वो सभी प्रोग्राम्स रिकग्नाइज्ड हैं। और रिकग्निशन के बारे में डॉक्टर जैन हमें अभी बताएंगे।
Actually, so most of the programs are our diploma levels, certificates program levels.
जी।
Developed by the a very good experts, the experts which are very much recognized in the countries. We have involved such people in developing these programs, designing this program. And all programs, like our MSc programs is there, OPG diploma programs is there, they are recognized by our UGC.
जी।
So all recognition is there. So, and the syllabus or content is so much good, so every person they feels happy when see the content. So
That's
recognition.
true. Okay. So, do we also, आपने बताया कि ज़्यादातर रूरल या सेमी अर्बन रीजन्स में हमारे जो प्रोग्राम्स हैं स्कूल ऑफ एग्रीकल्चर के, तो उसका लॉजिक भी है। बट डू वी ऑल्सो गेट स्टूडेंट्स फ्रॉम अदर अर्बन स्टूडेंट्स, इंटरनेशनल स्टूडेंट्स?
Yes, uh, nowadays new trend is there in agriculture. Earlier agriculture used to be business of the rural peoples.
जी।
Now you know people from the big institutions like IITs or IIMs, they are coming to learn the agriculture because they find good scope in agriculture sector. A lot of business opportunities there. So there are many students who are the pass out from the IITs, IIMs. They have joined our agriculture programs. And one of the success story, we can say from the certificate in organic farming, two students who are from the IITs, they have set up a startup, you know, in the production of organic farm produce, and they are doing very good.
That's very heartening to know. In fact, I have a success story of, something that I know, and I would be really happy to share it with our viewers. One of my friends, she had a little son, 5 or 6 year old child who refused to eat vegetables and fruits. And that lady, she came to IGNOU. She passed out the certificate in organic farming program, and she started organic farming, involved her child in the process, and the child in the process learned how to grow fruits and vegetables organically with a renewed respect and gratitude to the process of farming. And he is now all grown up, and he is participating. Along with his mother, he is taking care of the farm, and he eats all the fruits and vegetables. So this is a success story of a different kind, and I really wanted to share this because this is very relevant. I hope this friend of mine is listening to this, and this is very important that our the next generation gets to respect this process.
And you also asked about the international students.
Yes,
Yeah.
yes.
So two programs which are being offered to the international student under the Goal Guyana project and the E Vidya Bharati project. PG certificate in agriculture policy. This program is available in the open and distance learning as well as in the online mode.
Right.
And the program is also available under the E-Vidyabharati project, where 19 students are there from the African countries. They are doing this program, and the another programs is the value added products from fruits and vegetables, and there are 11 students are there from the Goal Guyana project.
Okay, so not only in India, but we have also gone to other countries with our programs with a lot of success. Our students, we have students from Africa who have undergone our programs from the School of Agriculture. Dr. Meeta, I will come back to you. Um, some of the certificate programs that the school is offering, and there is, I believe, also a non-credit program. Would you please like to tell us about that?
Yeah, certificate program I'd like to talk about, that is the certificate in poultry farming program. So we have many success stories from the students with a certificate in poultry farming. That is a program which is mainly developed to provide the knowledge and skills which are required at the poultry farming level. I mean to say that the students, after going through this program, they will have the knowledge and skills to manage the poultry farm. Through the theory and practical component, they will learn how to breed different poultry breeds, how to feed them, how to make their house, how to manage daily the poultry farm, and they will be doing the practicals also. They will be visiting a poultry farm. They will know how to manage poultry farm, layer or the broiler farm. It's layer for the egg purpose and broiler for the meat purpose. So after successful completion of this program, the students will definitely be in a position to manage independently a poultry farm.
Right.
And this program is available in different languages also, regional languages. We're offering it in English, in Hindi, in Mizo language, in Telugu, and any 8th pass students can take admission in this certificate program. So I'd like request Dr. Jain to talk about the other certificate programs.
There are altogether 5 certificate programs available in the School of Agriculture. Dr. Mehta has explained the poultry farming. We have the certificate in organic farming. Certificate programs are basically of 6-month durations, and we provide 2 years maximum duration. If students are not able to complete the program within 6 months, they can complete the program in 2 years. And there are certificate in organic farming, certificate in beekeeping is there, then certificate in water harvesting management, this program is there. Then there is another certificate program in sericulture. So there are 5 certificate program, and all these certificate programs are targeted to achieve to provide a special skill, and a special entrepreneurial skills, entrepreneurial avenue. So like certificate in organic farming, the learners, after completing this program, they can become organic producers, or they can undertake the marketing of agri produce. They can go for certification agencies, because certification and accreditation is one of the important activities. Every produce has to be tagged with a specific field, and so there is some number is there. So from that numbers only we can specify that the produce is organic or not. So certification is important aspect. So production, marketing and certification, these are the 3 aspects where student can go and they venture into the business. Then we have the certificate in sericulture. These programs we have developed with the help of the Department of Sericulture, Ministry of Commerce, and targeted to a special locations, where the business or the scope of production of sericulture is there. So there are lot of scope in the sericulture business. The lot of clothes or textile industries are there which are based on the silk. So diploma certificate in sericulture is one of the important program.
Thank you, Dr. Jain. At this moment, we would take a short break in the program, and we will come back in just a short while with lots more information for our viewers. Stay with us.
use honey in our everyday life. Normally we buy honey from market, but we don't know the quality of the honey. So we can judge the quality of the honey, whether it is pure or it is adulterated with sugar solution. We can do a simple test at home and you can judge whether the honey is pure or adulterated. For this test, we have to take a glass of water. Now we'll add a spoon of honey. Here you can see the honey is going to the bottom and it is not getting dissolved in the water. So this is pure honey. Now we'll take another glass of water and I'll add another sample of honey. Here you can see honey is getting dissolved in the water. That means this is not pure. This is adulterated with sugar solution. So this is a very simple test to judge whether the honey is pure or adulterated. We all use sugar daily, but we don't know the quality of the sugar, whether it is pure or it is adulterated with chalk powder or something like that. So we can do a simple test at home and you can see whether it is pure or not. So for this test, we need a glass of water. I'll put sugar powder in a glass of water and mix it well. If there is no sediment, if the solution is clear, then we know that this is a pure sugar sample. So here you can see the clear solution. That means the sugar is pure. Now we'll take another glass of water and we'll put another sample. Now you can see the sugar is not getting dissolved. That means there is impurity. The sugar is adulterated with chalk powder. You can see the turbidity. The solution is not clear. And if we keep it for some time, the chalk powder will settle down at the bottom, so we can see the sediment. So this is the difference between the pure sugar and the sugar adulterated with chalk powder. We all know that milk is a balanced diet and we all drink milk almost every day, but sometimes milk may also be adulterated with substances, inferior quality substances. So now in market synthetic milk is also available. For preparation of synthetic milk, sometimes detergent is used. So milk is adulterated with detergent. We can do a simple test and we can see whether the milk is pure or adulterated with detergent. So for this test, we need a test tube. I've taken milk sample in a test tube and we'll shake it. Here you can see there is no froth. That means the milk is pure. So there is no detergent in milk, that's why it is pure. Now we'll take another test tube and we have taken
हम फिर हाजिर हैं इस छोटे से ब्रेक के बाद अपना कार्यक्रम लेकर, जिसमें आज हम स्कूल ऑफ एग्रीकल्चर के प्रोग्राम्स से हमारे व्यूअर्स को अवगत करा रहे हैं। और ब्रेक पे जाने से पहले हमारे एक्सपर्ट्स डॉक्टर पी.के. जैन और डॉक्टर मीता हमें स्कूल ऑफ एग्रीकल्चर के प्रोग्राम्स के बारे में बता रहे थे। तो वहीं से शुरुआत करते हुए सबसे पहले मैं डॉक्टर मीता से पूछूंगी, before going on the break, we were talking about the master's degree program, the Masters of Science program. Would you please quickly just tell our viewers about the salient features or the main components of the program, and then we move on to
Okay,
some
sure,
other
ma'am.
programs?
This master's program is of 2 years duration, and maximum registration validity is for 4 years. And they are actually the first year is the PG diploma. Syllabus is same for PG diploma in food safety and quality management and masters. So first year there will be 36 credits of coursework. There will be theory and practical. The course has been, the masters and the PG diploma, they have has been designed in such a way that each student can have the concepts of theory, the principles which are involved in the food safety, food processing, food quality management, and they would also learn about the practical applications of those theories. They will learn how to do the microbial and chemical analysis of the food quality and food safety. They'll be doing some practical food safety and quality management, some auditing of the food industry, and they will be also doing one project work. That is a very important component in the first year of masters, and definitely the part of PG diploma program also. And the second year of masters, the students will learn in theory, some courses in theory. They will be presenting one seminar, and as they are the master students, so we have tried to develop their research capabilities also. So that's why you have kept a component of dissertation. So the 16 credits dissertation is there. The each and every students will be doing their research work either in food industry or in a food processing or testing lab, so that they can undertake the research studies in the emerging issues of food safety and quality. So these are the special features of this master's program.
Right. So I really want our viewers to take note of this, because despite being what everybody says an ODL university, we are very rigorous with our the components of the program, so that when the students complete the program and go out in the field to start their own work, or to work with one of the companies or with the government, they come with a strong background which IGNOU gives them. Thank you so much, Dr. Meeta. And now I would also want to let our viewers know about some of the other programs, because there is a long list of programs that the School of Agriculture is offering, and we are trying to do justice to all of them, while at the same time we would want to give a little information about each and every program that the school is offering. We don't want to miss out any of the programs. So Dr. Meeta, would you then like to let our viewers know about this postgraduate diploma in food safety and quality management?
Yeah, probably they have got the information while I was talking about the MSc program. That is a modular program. The first year component is solely for the PG diploma in food safety and quality management. So they will be learning the theory, practical on the means how to develop, design, implement, and audit any food safety and quality management in any food establishment. So that is the basic purpose of this PG diploma program. The diploma holders will have good opportunities in different food regulatories, in food accreditation and certification bodies, food testing lab and academic, and in food industry definitely.
Right. And there is another certificate program which is on agriculture policy.
Yeah. this एग्रीकल्चर पॉलिसी प्रोग्राम्स को हमें चालू किया था 2009 में
जी,
और इसका एक बहुत ही स्पेसिफिक उद्देश्य था। कि हम कृषि क्षेत्र को हम देखते हैं तो काफ़ी हमने विकास किया है। जो हमारा फूड ग्रेन जो प्रोडक्शन था, खाद्यान्न का उत्पादन था, वो 51 मिलियन टन हुआ करता था 1950 में। वो अभी 320 मिलियन टन से ज़्यादा हो गया। तो जो कृषि के क्षेत्र में जो वृद्धि हो रही है, जो विकास हो रहा है, उसमें बहुत सी चीज़ों का योगदान है। ऑफकोर्स किसानों का एक जो मेहनत करते हैं किसान, उनका बहुत बड़ा योगदान है। साथ ही साथ जो गवर्नमेंट की तरफ से समय समय पर बहुत सारे प्रोग्राम्स और स्कीम्स आए कृषि के क्षेत्र में
जी,
उनका भी एक बहुत बड़ा योगदान है। और जो प्रोग्राम्स और स्कीम्स कैसे बनती है ये भी सीखना ज़रूरी है, और बनने के साथ साथ उनको कैसे इम्प्लीमेंटेशन किया जाता है फार्मर्स फील्ड में और रूरल एरियाज़ में, उसको समझने के लिए, उसको सिखाने के लिए हम ये पीजी सर्टिफिकेट प्रोग्राम इन एग्रीकल्चर पॉलिसी स्टार्ट किया था। और इसका मुख्य उद्देश्य यही है कि जो मानव संसाधन, ऐसे मानव संसाधन विकसित करना जो कृषि क्षेत्र की नीति बना सकते हैं, उसको ग्रामीण क्षेत्रों तक और किसानों तक प्रॉपर तरीके से इम्प्लीमेंट लागू कर सके। क्योंकि कई बार पॉलिसी अच्छी बना लेते हैं, अगर उसको हम लागू नहीं कर पाए, उसको वहाँ किसानों तक जो टारगेट बेनिफिशियरी वहाँ तक हम ले जा नहीं सकते हैं, तो वो प्रोग्राम एक सक्सेस नहीं होगा। तो उद्देश्य यही था कि ऐसे ह्यूमन रिसोर्स डेवलप करें ताकि हमारी पॉलिसी जो कृषि नीति बनती है और स्कीम्स बनते हैं, प्रोग्राम बनते हैं, अच्छे प्रोग्राम बने, आवश्यकता के अनुसार बने। हर एक क्षेत्र की अलग से रिक्वायरमेंट होती है। कहीं पर कृषि का जैसे हम देखेंगे प्रोडक्टिविटी कम है, उत्पादकता कम है, तो वहाँ पर कई सारे कारण हो सकते हैं। हो सकता है कि वहाँ पानी के साधन नहीं हो सकता है कि वहाँ जो जो बीज उपलब्धता नहीं हो, अच्छी क्वालिटी के बीज की उपलब्धता नहीं हो सकता है कि किसानों के पास ज़मीन भी अच्छी है लेकिन उनके पास इतना पैसा नहीं हो कि वो बाज़ार से बीज खरीद सके।
जी।
तो कौन सी नीति बननी चाहिए, उसका एक एनालिसिस करने के लिए, फिर उसको इम्प्लीमेंट करने के लिए, तो ये हमने पीजी सर्टिफिकेट प्रोग्राम एग्रीकल्चर पॉलिसी बनाया था। और इसमें ऑफकोर्स किसान और जो हमारे ग्रामीण युवा है तो एक टारगेट बेनिफिशरी हैं इसी प्रोग्राम के, लेकिन इस प्रोग्राम में अच्छे पढ़े लिखे संस्थानों के लोग, इवन आईएएस और वो लोग भी आके इसको सीखना चाहते हैं कि किस तरह से पॉलिसी बनाते समय कौन किन किन लोगों को इन्वॉल्व करना चाहिए। किसानों को करना चाहिए, फील्ड फंक्शनरीज इन्वॉल्व होने चाहिए, गवर्नमेंट के फंक्शनरीज इन्वॉल्व होने चाहिए।
जी।
तो किस तरह की और कैसे पॉलिसी बनाने में और उसको इम्प्लीमेंट करने में कैसे भागीदारी बढ़ा सकते हैं।
जी, तो न केवल हमारी जो फार्मिंग कम्युनिटी है बल्कि जो पॉलिसी लेवल पे, इम्प्लीमेंटेशन के लेवल पे जो हमारे ब्यूरोक्रेट्स हैं या जो भी ऑफिशियल्स हैं जो उस प्रोसेस में किसी भी लेवल पे इन्वॉल्व रहते हैं, उनके लिए भी ये बहुत ज़रूरी है।
बहुत ज़रूरी प्रोग्राम।
जी। मैं ये अब इसके आगे ये भी जानना चाहूँगी डॉक्टर जैन, आपके स्कूल का एक प्रोग्राम है डिप्लोमा इन हॉर्टिकल्चर। तो हॉर्टिकल्चर और एग्रीकल्चर के कॉन्सेप्ट्स को पहले हमारे व्यूअर्स के लिए आप थोड़ा सा क्लैरिफाई कर दीजिए, फिर हमें ये डिप्लोमा इन हॉर्टिकल्चर प्रोग्राम के बारे में थोड़ी जानकारी दीजिए।
एग्रीकल्चर एक बहुत ही विस्तृत क्षेत्र है।
जी।
तो एग्रीकल्चर में जैसे शुरू में भी बताया था, फील्ड क्रॉप्स आती है, हॉर्टिकल्चर क्रॉप्स, हॉर्टिकल्चर में भी 3 तरह की क्रॉप्स आती है, जो फ्रूट्स क्रॉप्स हैं, वेजिटेबल क्रॉप्स है, ऑर्नामेंटल फ्लोरिकल्चर की क्रॉप्स है, फ्लावर, जो 3 अलग कैटेगरी होती।
जी।
तो हॉर्टिकल्चर बेसिकली जो फ्रूट्स प्रोडक्शन की बात होती है, वेजिटेबल प्रोडक्शन की बात होती है, साथ में फ्लोरिकल्चर जिसमें फल जो फूल उत्पादन की बात हो, ये 3 कैटेगरी के प्लांट, और साथ ही साथ लैंडस्केपिंग भी बात हो। लैंडस्केपिंग मतलब जैसे उद्यान बनाना है तो
जी।
कैसे बनाए, या कोई बिल्डिंग के आसपास को ग्रीनरी डेवलप करना है तो कैसे होगी। तो ये सब चीज़ें हमने डिप्लोमा इन हॉर्टिकल्चर में इंक्लूड किया है। तो 5 इसमें कोर्स हैं और 1 ईयर का प्रोग्राम है। तो बेसिक्स ऑफ हॉर्टिकल्चर, उसमें एग्रो क्लाइमेटिक कंडीशन, उसमें वेराइटी की हमने बात की है, उसमें सीड की बात की है, वेराइटी सीड की बात की, फर्टिलाइजर की बात की है, केमिकल की हमने उसमें बात की है, ट्रेनिंग एंड प्रूनिंग, बहुत सारी हॉर्टिकल्चर के रो में ट्रेनिंग एंड प्रूनिंग होती है तो उनकी बात की है।
जी।
हार्वेस्टिंग के मेथड्स अलग अलग होते हैं हर क्रॉप्स का, किसी की हमने लीफ को हार्वेस्ट करना है, किसी के फ्रूट को हार्वेस्ट करना है, किसी के रूट्स को हार्वेस्ट करना है।
बिल्कुल।
तो वो कैसे होगी हार्वेस्टिंग, कौन से समय पर हार्वेस्टिंग होगी, हार्वेस्टिंग के बाद पोस्ट हार्वेस्ट मैनेजमेंट में उनको छाया में रखना है, पानी डालना है, उनकी पैकेजिंग केसिंग, वो सब चीज़ें हम डिप्लोमा इन हॉर्टिकल्चर में सिखाया है।
जी, थैंक यू सो मच। और साथ ही जैसा आपने शुरू में ही प्रोग्राम में बताया था कि एग्रीकल्चर एक वास्ट एरिया है जो बहुत सारे कंपोनेंट्स को हाउस करता है, जिसमें सेरिकल्चर, डेयरी टेक्नोलॉजी, ये सब कुछ एस्पेक्ट्स आते हैं, पोल्ट्री फार्मिंग। तो अभी हम इन सारे एस्पेक्ट्स का थोड़ा तो आपने बताया। एक प्रोग्राम है आपका डेयरी टेक्नोलॉजी का, उसके बारे में भी मैं जानना चाहूँगी। और जो ये वाटरशेड मैनेजमेंट का प्रोग्राम है, तो मेरे ख्याल से डॉक्टर मीता, अगर आप पहले हमें डेयरी टेक्नोलॉजी के प्रोग्राम के बारे में बता दें।
Sure, ma'am. We are offering different diploma, undergraduate diploma programs in the area of different food processing. Like you took one example of dairy technology. There is another one, meat technology.
जी।
Another diploma program in fruits and vegetables. So all these 3 programs are basically means they are having the components of theory and practical, which involves around the basic production, primary production of the maybe fruits and vegetables, or in case of dairy technology it is milk production, in case of meat it is meat production. Then the processing of this different food, then their processing after the preservation, their packaging, their quality assurance, the marketing aspects, all these diploma programs are having definitely one course specifically for the marketing and entrepreneurship in the specific area. For example, in fruits and diploma in value added products from fruits and vegetables, there is one component of marketing entrepreneurship, so that the students, after going through this program, after successful completion of this diploma program, they are in a position to start their own business in that specific area. If it is dairy technology, the students will learn how to manage the dairy animals, how to produce the clean milk, how to transport the clean milk from the farmers to the chilling center, then what is done at the chilling center, how the liquid milk is processed. In market we see that pasteurized milk, homogenized milk, how these are processed, how the different value added products are prepared, different dairy products, like for example you take ice cream, ghee, butter, cream, sweets, different fermented products like the ghee curd, yogurt, so many dairy products are in the market. So the students will learn about all the processing of all these value added products, even the byproducts of the dairy also, for like whey protein. Right now many people are interested in having whey drinks, so that is a byproduct of the dairy industry. Similarly, in case of dairy fruits and vegetables diploma, students will learn how the fruits and vegetables are collected from the farmers, how they are graded, sorted, primarily processed, then preserved by different methods like candy making, the jam, jelly preparation. They will know how to
Sauces.
prepare sauce, ketchup, pickle, marmalade, so many different fruits and vegetable products. So they will know about them, and they will know how to package them, how to maintain the quality, and how to market them. In case of diploma in meat technology, similarly, the students will learn what are the different meat animals, conventional and non-conventional meat animals are available in India, how they are managed in a farm, then how the meat, fresh meat is produced from slaughter of the animals, then how the meat is processed into different products. For example, if you have seen in the market products like tandoori, kebab, korma, biryani, then sausage, nuggets, patties, meat pickle, so many meat products are available in the market. Students will learn about the processing, preservation, packaging, quality assurance, and marketing of all these meat products in the diploma in meat technology program.
Right. And that is so valuable, not only for somebody who will be, doing or starting the business on their own, but also for somebody who will be in the marketing, right? So we are talking of the primary sector as well as the secondary sector and the tertiary sector. All of these, even though agriculture is seen mostly as a primary sector activity. Um, Now we move ahead and go to Dr. Jain. Would you please also tell us about the watershed management program that the school is offering, Dr. Jain?
डिप्लोमा इन वाटरशेड मैनेजमेंट, जल संचरण प्रबंधन,
जी,
ये इस प्रोग्राम का टाइटल है। और ये प्रोग्राम बेसिकली हमने मिनिस्ट्री ऑफ रूरल डेवलपमेंट, वहाँ का फाइनेंशियल सपोर्ट मिला है।
जी,
डिपार्टमेंट ऑफ लैंड रेवेन्यू, दे हैव द सेपरेट डिपार्टमेंट। एक्चुअली इसका इस प्रोग्राम का रिक्वायरमेंट वहाँ से आया था कि हमें डिप्लोमा इन वाटरशेड मैनेजमेंट प्रोग्राम स्टार्ट करना है।
जी,
एक्चुअली अब जब एग्रीकल्चर की बात करें या रूरल एरिया में बात करें कि एक डिस्ट्रिक्ट एक यूनिट होती है, लेकिन वाटरशेड एक डिफरेंट टाइप की यूनिट होती है। एक वाटर का एक सोर्स होता है, वो सोर्स एक एरिया को, एक कैचमेंट को कवर करता हो। तो उस कैचमेंट में जो भी एक्टिविटीज होती है, एनिमल प्रोडक्शन की एक्टिविटी हो, एग्रीकल्चर की बात हो, है ना, फील्ड की क्रॉप्स हो, वेजिटेबल क्रॉप्स हो, पोल्ट्री फार्म हो, उस कैचमेंट एरिया में जो भी बिजनेस होते हैं, जो भी एक्टिविटी होती है, वो सब वाटरशेड में कवर होती है। तो वाटरशेड बेसिकली एक होलिस्टिक अप्रोच होती है, जो एक कैचमेंट एरिया के डेवलपमेंट की उसमें हम बात करते हैं। तो उसमें एग्रो फॉरेस्ट्री भी आ जाती है, सेरिकल्चर होगा तो सेरिकल्चर भी आ जाएगा वहाँ पर, तो पोल्ट्री फार्मिंग भी आ जाएगा, ऑर्गेनिक फार्मिंग भी आ जाएगा। तो इस प्रोग्राम में बेसिकली हमारा उद्देश्य ये था कि उस कैचमेंट एरिया में कैसे डेवलप कर सकें, वहाँ का जल को संचरण करके। वाटर एक जल एक प्राइमरी यूनिट है
जी,
उसके बेसिस पे, उस पर जो डिपेंडेंट एक्टिविटी है उनको करके वहाँ का लाइवलीहुड इम्प्रूव किया जा सके, उससे ये एक बेसिक उद्देश्य इस
yeah. So this is a very important component of the sustainable living aspect of, when we look towards the future and everywhere all over the world everybody is talking about sustainable living. तो ये बहुत ही महत्वपूर्ण उसका एक पहलू है जिसको आप कवर
ये
कर रहे हैं
बेसिकली
अपने
एक
प्रोग्राम
समेकित
से।
इंटीग्रेटेड अप्रोच है।
जी
उसमें जितने भी एंटरप्राइजेज है, जो भी एक्टिविटीज है, उसको इंटीग्रेट करके उस एरिया को, कंप्लीट एरिया को डेवलप करना।
जी
और इसके लिए इंटीग्रेटेड वाटरशेड मैनेजमेंट एक स्कीम भी होती है।
जी
और उस प्रोजेक्ट इम्प्लीमेंटेशन यूनिट, बहुत सारी यूनिट्स इसमें एक एजेंसी, गवर्नमेंट एजेंसी भी है, नॉन गवर्नमेंट ऑर्गेनाइजेशन में इसमें इन्वॉल्व होते हैं। उन सबको एक ट्रेनिंग, एक कैपेसिटी बिल्डिंग के लिए वाटरशेड मैनेजमेंट का प्रोग्राम।
डॉक्टर जैन, आपने अभी बताया कि ये मिनिस्ट्री की इंटरवेंशन के साथ आपने ये प्रोग्राम शुरू किया, तो मुझे उत्सुकतावश मैं ये भी जानना चाहती हूँ और मेरे ख्याल से हमारे व्यूअर्स को भी ये जानकर अच्छा लगेगा, क्या कुछ ऐसे प्रोजेक्ट्स हैं जो हमारे स्कूल ऑफ एग्रीकल्चर ने गवर्नमेंट ऑफ इंडिया या कुछ स्टेट गवर्नमेंट्स के साथ किए हैं?
बहुत सारे प्रोग्राम्स बेसिकली जो हमने डेवलप किए स्कूल ऑफ एग्रीकल्चर में,
जी
और डिफरेंट डिपार्टमेंट के सहयोग से
जी
मिले हैं। जैसे डिप्लोमा इन फूड सेफ्टी एंड क्वालिटी मैनेजमेंट, सर्टिफिकेट इन ऑर्गेनिक फार्मिंग, ये दोनों प्रोग्राम हम एपेडा, जो एक्सपोर्ट डेवलपमेंट अथॉरिटी एग्रीकल्चर में है, उनके सहयोग से, वहाँ से फाइनेंस हमें मिला है, वहाँ से फंड मिला है इन प्रोग्राम। क्योंकि एक्चुअली एग्रीकल्चर को हम डेवलप करना है, और एग्रीकल्चर को उत्पादन है डोमेस्टिक कंजम्पशन के साथ साथ हम एक्सपोर्ट में लेके जाना है।
जी
तो एक्सपोर्ट के हिसाब से प्रोडक्शन करने के लिए स्पेसिफिक ट्रेनिंग की ज़रूरत है किसानों के लिए भी।
बिल्कुल
ठीक है ना, क्योंकि हमें प्रोड्यूस डोमेस्टिक मार्केट के अनुसार नहीं करना, हमने प्रोड्यूस करना है इंटरनेशनल मार्केट के अनुसार।
जी
जो वहाँ के नॉर्म्स है, वहाँ की गाइडलाइंस, उनको फॉलो करना है। इसलिए फूड सेफ्टी एंड क्वालिटी मैनेजमेंट, क्योंकि हमारा काफ़ी एक्सपोर्ट होता है फूड के सेक्टर में, फूड प्रोसेसिंग के सेक्टर में, तो फूड सेफ्टी का प्रोग्राम्स और ऑर्गेनिक फार्मिंग, क्योंकि केमिकल रेजिड्यू नहीं हो।
जी
क्योंकि
बिल्कुल
एक्सपोर्ट करना चाहते तो केमिकल रेजिड्यू, पेस्टिसाइड रेजिड्यू, वो सब नहीं होना चाहिए। तो उसी को ध्यान में रखते ये पीजी डिप्लोमा इन फूड सेफ्टी एंड क्वालिटी मैनेजमेंट, सर्टिफिकेट इन ऑर्गेनिक है। उसी से तरह से जो सर्टिफिकेट इन सेरिकल्चर जो प्रोग्राम हमारा चलता है, वह भी एक फाइनेंशियल सपोर्ट मिला है 50%, तो वहाँ के सहयोग से मिला है। तो इस तरह से काफ़ी प्रोग्राम्स हमारे, डिप्लोमा इन वाटरशेड मैनेजमेंट का मैंने आपको बताया ही है, तो
जी
ये भी हमारे फाइनेंस। उसके अलावा जो बहुत सारी गवर्नमेंट एजेंसीज हमें हेल्प कर रही है एग्रीकल्चर के प्रोग्राम्स की रीच बढ़ाने में, जैसे फूड सेफ्टी अथॉरिटी ऑफ इंडिया, उनसे भी हमें हेल्प मिलती है।
जी
उसके अलावा हमारे यहाँ से रिसर्च प्रोजेक्ट भी हमने किए हैं, जो आईसीआर के साथ के से रिसर्च प्रोजेक्ट भी हमने किए हैं। डॉक्टर मीता भी इसमें कुछ
In addition to what Dr. Jan has already mentioned about the different ministries, we have also got the financial support from the Ministry of Food Processing and Industries for the development of 5 diploma programs in the area of food processing, like the dairy technology, meat technology, fruits and vegetables technology, then cereal pulses and oil seed, and fish products technology.
Right.
So we got the financial support from the Ministry of Food Processing Industries. Then we also have the project with Food Safety and Standards Authority of India, which is the food regulator in India actually, and in collaboration with that authority, we had our regular interactive radio counseling program for creating the public awareness. Same time, we are helping our students also to learn the concepts of food safety and quality management, and we are also making the people aware about the new aspects of food safety and quality, the new food regulations. And we also had one project with that same authority for the training of the housewives in terms of in their knowledge in food safety and quality management. Right now, we are also continuing that project with the authority.
Right. And I believe there are a lot of other, certificate programs that the school is offering. I'm bringing you to this because we have just a few minutes left before our program, brings its curtains down. So before that, I would like and Dr. Jain, if you could tell about this and the certificate programs that the school is offering, apart from the ones that we have already told.
there is a programs, water harvesting management,
Right.
Jal Sancharan and Prabandhan.
Very important
programs, particularly for urban areas.
Absolutely.
जो एक्चुअली अभी जो कोई भी बिल्डिंग बनाते हैं, तो गवर्नमेंट की गाइडलाइन है आपको वाटर हार्वेस्टिंग सिस्टम डेवलप करना पड़ेगा,
जी।
देन ओनली यू विल गेट द परमिशन। तो आपको कोई भी बिल्डिंग बनानी है, बड़ी बिल्डिंग बनानी है, तो वहाँ पर जल संचरण आपको डेवलप करना पड़ेगा। उसके लिए कैपेसिटी बिल्डिंग, कैसे हम एक्चुअली जल संचरण बनाना है, वाटर हार्वेस्टिंग सिस्टम डेवलप करना है, तो पहले हमने देखना पड़ेगा कि कितनी बारिश हो रही है, कितना पानी का इंटेक है हमारे पास है उस प्रोमिस में, उस
जी।
एरियाज में कितना पानी, तो उसको कैसे कैलकुलेट करेंगे, किस कैपेसिटी का बनाना है। तो उस पर्पज से हमने सर्टिफिकेट इन वाटर हार्वेस्टिंग एंड मैनेजमेंट बनाया है। 6 मंथ का प्रोग्राम है, 4 कोर्सेज है, थ्योरी एंड प्रैक्टिकल दोनों कंपोनेंट इस प्रोग्राम में।
राइट, एंड इट इज़ रियली रेलिवेंट। हम देखते हैं कि जब हम शहरों में रहते हैं, थोड़ी सी बारिश होने पर बाढ़ आ जाती है और वो पानी वेस्ट हो जाता है। तो इवन इफ वी वांट अवेयर सिटीजन्स हु कैन कंट्रीब्यूट टू this program is still an absolutely relevant program. Apart from this, we have the certificate in beekeeping program. Dr. Meeta, would you like to tell us about this?
Dr.
अच्छा, डॉक्टर जैन बोलिए। यस, प्लीज प्लीज गो अहेड सर।
बी कीपिंग इज बेसिकली जो शहद पालन का जो प्रोग्राम है,
जी।
मधुमक्खी पालन का प्रोग्राम है, और शहद उत्पादन इसका मुख्य उद्देश्य है।
जी।
और एक्चुअली इसका फार्मर्स की इकोनॉमी में जो मेन क्रॉप के साथ बी कीपिंग हम करते हैं,
जी।
मधुमक्खी का पालन करते हैं, तो 2 फायदे हैं। एक तो अगर सरसों के खेत के पास अगर आपके मधुमक्खी के बॉक्स लगा देंगे तो आपका सरसों का उत्पादन भी बढ़ेगा, एक उसका, क्योंकि पोलिनेशन इससे बढ़ता है।
बिल्कुल।
तो एक ये, दूसरा जो उद्देश्य है, किसान के पास एक एडिशनल अतिरिक्त आय हो जाती है इसको करने से। तो उसका मेन जो फसल है उसका उत्पादन बढ़ेगा, उसकी आमदनी में बड़ी बढ़ोतरी होगी, क्योंकि इसमें ज़्यादा रिसोर्सेज की ज़रूरत नहीं पड़ती है। तो शहद उत्पादन कैसे कर सकते हैं, शहद उत्पादन के अलावा दूसरे और भी बाय प्रोडक्ट हैं बी कीपिंग के, उनसे भी आमदनी होती है। तो शहद उत्पादन के क्षेत्र में फार्मर्स की ट्रेनिंग, कैसे बॉक्स होते हैं, कैसे रखना है, कौन सी वैरायटी का बी लेके आना है, जो डोमेस्टिक वैरायटी, तो वो सब चीज़ें कहाँ से मिलती है, कैसे प्रोजेक्ट डेवलप करना है, कैसे शहद की पैकिंग करनी है, उनकी मार्केटिंग कैसे होनी है, ब्रांडिंग कैसे होनी है, वो सब चीज़ें हमने उस प्रोग्राम में सिखाया।
That's wonderful. So I believe we have been able to cover all the programs that we intended to bring to our viewers today. साथ ही साथ चलते चलते लास्ट के 1 मिनट में मैं डॉक्टर जैन से ये गुजारिश करूँगी, क्योंकि हम आजकल जो भी हायर एजुकेशन में पढ़ाई हो रही है देश में, उसको हम NEP 2020 के कॉन्टेक्स्ट में ज़रूर देखते हैं। ना केवल हम एज शिक्षक, बल्कि जो स्टूडेंट्स हैं वो भी देखते हैं कि इससे उनको क्या लाभ मिलेगा। तो चलते चलते आप ये हमारे व्यूअर्स को बता दें।
NEP 2020 में जो एक उद्देश्य है कि जो ऐसे हमें विद्यार्थी तैयार करने हैं जो पढ़ाई के साथ साथ कुछ और रोजगार से मिले, ऐसी स्किल्स उनको मिले। तो उसी स्किल्स को देने के लिए हमारे स्कूल ऑफ एग्रीकल्चर के प्रोग्राम्स है। तो पोल्ट्री फार्मिंग, बी कीपिंग, वाटर हार्वेस्टिंग, ये सर्टिफिकेट इन ऑर्गेनिक फार्मिंग, डेयरी टेक्नोलॉजी, मीट टेक्नोलॉजी, ये सब प्रोग्राम ऐसे हैं जिनको करने के बाद स्किल बिल्डिंग के प्रोग्राम है। स्किल बिल्डिंग करके कुछ एंटरप्रेन्योर स्टार्टअप एक्टिविटीज कर सकते हैं। तो जो NEP का फोकस है कि हमें स्टूडेंट्स को एक जॉब सीकर की जगह जॉब प्रोवाइडर में कन्वर्ट करना है, हमारे ह्यूमन रिसोर्सेज को जॉब प्रोवाइडर में कन्वर्ट करना है। उसी को उद्देश्य को ध्यान में रखते हुए हमने स्कूल ऑफ एग्रीकल्चर के प्रोग्राम से, दूसरी जो मुख्य जो विशेषता हमारे प्रोग्राम की है कि हमारे प्रोग्राम मल्टी डिसिप्लिनरी है। एक बी कीपिंग की हम बात की है, तो बी कीपिंग कौन से बीज की बात नहीं की, उसकी मार्केटिंग कैसी होगी, बीज उसका जो प्रोजेक्ट कैसे डेवलप करना है, बी कीपिंग
साइंस भी है,
साइंस भी है, मैनेजमेंट भी है, मार्केटिंग भी, सब एक पूरा एक कंप्लीट एक पैकेज हम देते हैं स्टूडेंट्स को। तो ये एक दूसरी विशेषता हमारे प्रोग्राम से जो NEP को के अनुसार है।
बिल्कुल। और साथ ही साथ जैसे डॉक्टर मीता ने कुछ समय पहले बताया था कि मल्टीलिंगुअल भी हैं प्रोग्राम्स, तो हमने जस्टिस करने की कोशिश करी है। जो प्रोग्राम स्कूल ऑफ एग्रीकल्चर ऑफिस ऑफ़र करते हैं उन सब के बारे में जानकारी देने की हमारे व्यूअर्स को। इसके अलावा आप कुछ भी और जानकारी चाहें ज़रूर इग्नू के वेबसाइट पे स्कूल ऑफ एग्रीकल्चर का वेब पेज विज़िट करें, या हमें ईमेल करके भी आप जानकारी हासिल कर सकते हैं। ईमेल आईडी नोट करिए ssc@ignou.ac.in। और इसी के साथ प्रोग्राम का समय समाप्त होता है। मैं बहुत बहुत धन्यवाद देना चाहूँगी हमारे एक्सपर्ट्स को, डॉक्टर जैन और डॉक्टर मीता। आप यहाँ आए, हमारे व्यूअर्स को आपने ये जानकारी दी, आपका बहुत बहुत आभार।
धन्यवाद।
थैंक यू सो मच। एंड व्यूअर्स, आप अगले जो हमारा चौथा मंडे होगा इस महीने का, उसमें हम फिर हाजिर होंगे एक और डिवीज़न या स्कूल की जानकारी लेके। तो हमसे ज़रूर जुड़िए। तब तक सीखते रहिए, बढ़ते रहिए। नमस्कार।
Are you interested in television journalism or radio journalism or online journalism? Or do you want to learn with the flexibility of open learning? Or if you are a working professional, wants to enhance your knowledge and skill with certification in the field of electronic media, then School of Journalism and New Media Study IGNOU offers PG Diploma in Electronic Media for you. This program includes audio and audio-visual program production for radio, television and online platforms. Here are some important details about the program. We have total 8 courses of 32 credits, 6 theory courses, 1 practical and 1 project. Eligibility: bachelor's degree in any subject. Minimum duration 1 year, maximum 3 years. Medium is English, but the students can write their examinations, assignments, practical and project in Hindi also. So if you are interested in television, radio or online media, please come and join IGNOU's PG Diploma in Electronic Media.
Good afternoon and welcome to this session on nursing management of patients with eye and ear disorders. Eye and ear disorders both are a lot of disorders, and they affect the very important sensations of one's body, that is vision as well as hearing. In the first section, we'll be studying about the various eye disorders that affect the human beings and how nurses can manage these disorders. And in the second part of our presentation, we will study about ear disorders, how the different ear disorders occur in the body, and how nurses can manage, what is the treatment, and how do you need to go about it. So first we will talk about the disorders of the eye and their management. What is the most important thing in our human life is that we can see various things, and the most important organ associated with it is eye is associated with the sensation of sight. Any problems which directly affect the eye can create vision problems along with the problems in sensing the color and conduction of day to day activities. Hence one should be aware of these problems, and also as a nurse one should know how do we need to deal with these patients of eye disorders. There are various eye disorders which affect the human beings. There is a list which is given. There are infections, there are errors of accommodation and refraction, there are diseases of the lens, tumors can occur, retinal detachment can occur, ocular trauma and injuries to the eye, blindness, glaucoma, macular degeneration are some of the very important disorders of the eye. In your life, you must have met many people, old as well as young, who are suffering from one or other disorders of the eye, be it infection, be it glaucoma, and sometimes cataract, which is very common in the elderlies. So, going on, the first most important discussion that we will do is on the infection of the eyes. The eye itself consists of various areas, and based on these areas, infections have been determined. First of all, we will talk about the infections of eyelids and the lacrimal glands. The first most important infection of eyelids and lacrimal gland is stye. Stye affects the sebaceous glands in the lid margin, and it is caused by staphylococci. And there is presence of redness, swelling, warmth, pain, as well as pustules, that is pus filled small papules may be there, and they are usually present on the lid margin. You can see in the photograph that the person is having a stye. The other important infection is chalazion. That is chalazion, you can also say. It is a non-infected granulomatous, that is a cell injury type of inflammation which usually affects the sebaceous glands. It occurs when there is a blocked sebaceous gland and it ruptures and it releases its material into the lid tissue. It is just like a sterile cyst, but it is within the lid. You can see this patient, he is having chalazion. Stye and chalazion sometimes the same. However, stye has a more profound pus as compared to chalazion. Then we have blepharitis. Blepharitis is the inflammation of the lid margins. It occurs due to staphylococcus or non-infective processes which are seborrheic, that is either because of seborrheic eczema, or it may be parasitic in origin. Then entropin. Entropion is one of the problems in which there is inward turning of the upper or lower eyelid of one or both the eyes. It is usually when the child is born, it is present. You can see in the photograph, the eyelid has been turned inwards. The next is extropion. So it is the opposite of entropion. In this, there is outward turning of the lower eyelid, eyelashes due to some injury, like there may be tumors or there may be some fluid or there may be injury which can lead to it. Then there is dacrocystitis. It is the inflammation or the infection of the lacrimal sac. Lacrimal sac contains your tears. The tears are usually present there, but if there is some infection here, it can lead to dacrocystitis. This can be either congenital, which is usually present in newborn babies, or it can be acquired, that can be due to infection. Usually in this case, watering of the eyes is present. Lot of water comes out and there is inflammation. Then next is the infections of the eyelids and lacrimal glands which are associated. Conjunctivitis, one of the most common, mostly present in children. You will see that if the people have conjunctivitis, they are told to wear goggles or black kind of spectacles, and they are also told that this is inflammation, or you can say red eye. It is the inflammation or infection of the conjunctiva layer of the eye. It is either due to mechanical trauma, like for example sunburn, or because of infections, or maybe bacterial in origin, or maybe viral. Or it may also be because of the allergies. There is burning, redness of the eye. There may be foreign body feeling. The person may say, something is stuck in my eyes, I cannot open it. There is mucopurulent discharge. Sometimes infection may be so solid that pus may come out. And sometimes it is also termed as keratoconjunctivitis if it affects the both cornea as well as the conjunctiva layer of the eye. So it is very infectious. Usually it is advised to always wear goggles or spectacles in this case. Next is infection of the eyelids, which is trachoma. It is the other form in which there is involvement of the keratoconjunctivitis. That is, your cornea as well as conjunctiva layers are affected. The most important thing to remember is that this infection is usually present in children, and it is usually caused by chlamydia trachomatis. It is the leading cause of preventable blindness. It occurs usually in younger age or lower socioeconomic status. There is a direct spread of this infection, and the source is the conjunctival discharge which is coming out. There is irritation in the eye, eyelids may stick, and there is lot of watering. In the figure or the diagram or the picture, you can see there is a presence of a severe redness of the eye, and you can see that the lacrimal gland is also affected. Next is the infections of the cornea or the anterior chamber of the eye. Tigrium is one of the triangular horizontally oriented thickening of the conjunctiva, and it is also known as the surfer's eye. In this, the infection extends beyond the cornea and goes onto the top layer of the eye. You can see that it starts from the sclera as in the picture, and it is going to the corneal layer of the eye. Next is keratitis. Keratitis simply means infection or the inflammation of the cornea. Your cornea may appear to be a little blurred, and there you can see that it is reddened also. It is usually due to bacteria, virus or allergies. There is edema, infiltration as well as congestion. It can be acute or chronic. Patient may say he has lot of pain, there is redness of the eye, he may have difficulty in seeing the light, which is known as photophobia. There is swelling, blurring of the vision, as well as there also occurs a blepharospasm. Your eyes may be spastic, they may also trigger or twitch over the time. It also can cause visual losses. Then corneal ulcer. It is an ulcer which is present on your cornea. There is a discontinuation in the normal epithelium. It is associated with the necrosis of the surrounding tissue. There is infiltration and ulceration. It starts as a small minor aberration, and there is also yellowish white area, oval or irregular shape. Symptoms are similar to keratitis. How will you affect or help a person in this case? You will tell the patient to do facial cleaning and shampoos to remove the scales, local antibiotics for bacterial infection, antibiotic creams, steroids and NSAID drugs, cycloplegics in order to give the eye rest, dark glasses, as I've already told, in many cases this can be prescribed, pain relief with the help of analgesics, good diet, hygiene, as well as avoiding the use of towel, handkerchief or summa rods which have been used elsewhere. So hygiene is also very important in order to avoid the infections of the eye. The next is the errors of accommodation as well as refraction. Refractory errors occur when the light rays are not focused appropriately on the retina, and errors of accommodation occur when there is difference in accommodation power of the eye. What happens is that the refractory errors is myopia, short-sightedness. Person can only see something which is near to him. Light rays get focused in front of the retina. Poor vision. You cannot see at the distance, you can only see what is near you. Eyeballs become prominent, there is a large cornea and pupils. Refractive power is strong. So what we do in this case, we may use a minus lens, that is concave lens, in the spectacles, and we can tell the person to wear those spectacles. Sometimes surgery may also be done, which involves keratomy as well as LASIK laser and orthokeratology. This may be prescribed for the patient. Then there is hypermetropia, that is long sightedness. Person can see nicely at the distance but cannot see what is near him. So he will have difficulty in reading the books, but he can see very nicely away things, like he can see the train which is running fast away from him, but he cannot see the things which are near to him. So for this case, convex or plus lens can be used, and patients may have difficulty in reading, they may have headache, so we have to help the patient by giving him proper spectacles, that is convex lens spectacles. Next is astigmatism. Astigmatism is something in which the rays of the light are not bent properly and they are focused in various directions. This occurs when the curvature of the cornea is not perfectly square. It causes poor vision and we can correct it with the help of a cylindrical lens. Strabismus is the error of accommodation. Proceeding further, it is just like a squint. Person cannot focus both the eyes simultaneously. There is imbalance of the extraocular muscles. Eyes can deviate in and out, up or down. There may be a paralysis of the extraocular muscles, or it may also not be because of paralysis, but there is some problem with the muscle tone of the eyes. The glasses with prisms help to restore certain amount of vision. There is also a prescription of botulinum neurotoxin A in order to inject in a weakened muscle in order to strengthen it. And surgery may also be done in order to tighten any kind of restricted movements and tighten the muscles of the eye. So strabismus can be dealt in this way. Next is presbyopia. Presbyopia is usually the complication of various eye disorders with the lack of accommodation power in the eye. Age is most commonly related to it. The treatment involves LASIK, sclerotomy, and keratoplasty. Convex lens glasses are usually used in this case. How do we manage? Moderate to severe refraction problems are considered for the surgery. Surgery is done on an OPD basis. Eye protection is provided with goggles. Vigorous activities and eye makeup is told to be avoided. Steroid eye drops are utilized for inflammation, and refraction stabilizes slowly with the periods of waxing and waning after the management is prescribed. The next is the diseases of the lens, cataract. Cataract is very common in old age, and you can see how the cataract is affecting the eye. It can even lead to blindness. The causes can be congenital because in the childhood, or maybe due to acquired like age, radiation, electrical injuries, any kind of diseases that affect the human beings, ocular and intraocular diseases, as well as trauma or foreign bodies. Usually we require to do no medical management, only surgery is prescribed. There may be cryosurgery, which involves freezing of the lens, extracapsular surgery, which involves removing the anterior portion of the lens, intracapsular surgery, which involves removing the whole lens, and phacoemulsification, in which titanium needle vibrates at the ultrasonic frequency to emulsify the lens, and then lens can be put in the intraocular position. Preoperatively, we need to take the history, do the examinations, give the prescribed eye drops, prepare the patient, prepare the patient for the consent, prepare him for hygiene, and then we need to give dilating pupil eye drops, and we have to lower the intraocular pressure so that we are able to do the surgery. That can be through variety of drugs which are mentioned in the slide. In the post-operative care, we need to leave the eye patch in the place at least for the 10 days. Patient is told not to rub his eye and not to get anything into his eyes. The patient is told to rest and avoid lifting anything. Sleeping on the operated side and straining is totally no-no. He has to avoid soap and water. He has to take medications as prescribed. He has to avoid aspirin and derivatives. And if there is any complications like unrelieved pain, redness, nausea and vomiting, these have to be reported to your physician immediately. The next is ocular tumor. Tumor is also very common in the eyes. It affects the eye and its structure. It can be primary from the eye itself, or a secondary source may be there somewhere else in the body, and then it travels to form the ocular tumor. There may be benign neoplasm and there may be malignant tumors. Malignant tumors usually metastatize in order to produce space occupying lesions which usually are present in the brain. How do you manage? In this case, we usually do removal of the eye, which is known as enucleation. There are two types of procedure. One is eversiation, in which there is removal of the contents of the eye with the retention of sclera, and there can be excenteration, in which there is removal of the entire eye and all other soft tissues in the bony orbit. The non-surgical treatment includes radiation therapy, cryotherapy, laser photocoagulation, chemotherapy, and brachytherapy. Then fifth one is retinal detachment. As the name suggests, retinal detachment means detachment of retina from its position. You can see that in the picture, retina has detached from its position, and whatever space is left behind, there is presence of a fluid. Fluid starts accumulating in this place. So there is separation of retina from the pigmented epithelium, and it is very acute. That is, during trauma, it suddenly occurs and there is a sudden onset. There is a space created which fills with the fluid. The person may feel a burst of black spots or floaters or dark cloud or curtain which is falling in front of eye, and hence there may be vision problems. There are sensation of flashes in front of his eyes. There is no pain, however the patient may have vision problems. If the detachment extends beyond, it may also include maculae, and then total blindness can occur. What do we do? And what are the causes is, first you need to know that it can occur because of trauma, because of aging, family history, or maybe some other surgery has been done, and it can complicate to retinal detachment. Sometimes mechanical pulling of the retina due to certain inbuilt diseases of the body like diabetic retinopathy and ocular injury due to ocular diseases may also be the reason for causing retinal detachment. Now, how do we manage it? The first and most important thing is surgery. There are variety of surgeries which have been listed: photocoagulation with the use of laser beam to fuse the detached area, cryoretinopexy, which is the cold probe on the sclera to provide treatment to the retina. Scleral buckling can be done. We can buckle up the detached retina. Then vitrectomy, which is the removing of the vitreous chamber to better see the retina, draining of the fluid which has been accumulated, and intravitreal bubble of air or gas can be put so that it pushes the retina back into its position. So these are the various surgeries which can be done in case of the retinal detachment. Next comes the ocular trauma. Ocular trauma stands for injuries to the eye. There are various mechanical causes of the injury to the eye, which can be foreign body, blows, perforations, as well as penetrations. There can be non mechanical causes like chemical injuries, burn injuries, which are thermal injuries, radiation injuries like ultraviolet radiations, and electrical injuries. So all these can lead to ocular trauma or injuries to the eye. What do we see? We usually have a patient with painful red eye. There is a decreased vision, photophobia, absent ocular movements, swelling, ecchymosis, fluid which drains from the eye, lacrimation or watering of the eye, foreign body presence is felt, and then bleeding or hemorrhage may be there. How do we manage? First and most important thing is to provide first aid and medical care. If there is burns or mechanical and thermal injuries, we need to flush the eye with cold water. If there is injury because of insect or some dust or loose substance, we can pull out that to dislodge. However, for perforating and penetrating injuries, we should not do this. And then we need to irrigate the eye. If there is some contact like contusion, ecchymosis, or laceration, we need to examine the eye, provide cold compress, and then cover the eye immediately. If there is penetrating injury, do not remove the object, and then we need to use the protective sheet and then cover the uninjured eye. In any case, we have to go to the eye specialist. If we have to provide nursing care, what do? We need to tell the patient to wear the goggles if he is involved in any kind of active support or activities which require the protection. If there is any spray of aerosols, it should be away from your eyes. If there is any, you are working in the kitchen, and if there is any steam, it should be away from the eyes. We should not look at the solar eclipse without the filters. We need to keep the dangerous chemicals away from the children. Handle the glass items carefully, because if they can dislodge in the eye, there is severe damage to the eye. Do not explode firecrackers at Diwali, and it has to be done carefully. So this is how we manage the various ocular trauma that is there. Next is blindness. Blindness is also very common of the eyes. Blindness can be of various types. Then there can be also color blindness, and there can be night blindness. Blindness is a visual acuity of less than 3/60 or its equivalent. There is legal blindness, which means vision in the blind eye is less than 1/60 in the perception of the light. Preventable blindness is the one that can be prevented by removing the cause. Curable blindness means vision can be restored once you timely intervene for the patient. Color blindness means defect or absence in the sensation of one or more primary colors. A person cannot see one or more primary colors. Night blindness occurs when the rods in the eyes are deranged and hence the person cannot see anything at night or in the poor light. It is usually a deficiency disorder associated with vitamin A deficiency. So, what are the causes and how do we manage it? In case of blindness, usually the causes are other kinds of eye problems like cataract, refractory errors, glaucoma, infections, childhood blindness, ocular injuries, diabetes, and furthermore. The management is to treat the cause of these diseases. If there is color blindness, it can be congenital or acquired due to old age or macular degeneration. Management is to treat the cause. If there is night blindness, as I've already told you, the cause is vitamin A deficiency or short sightedness or congenital malformations, or if there is open angle glaucoma. Management is use of corrective lens and sometimes surgery for the cataract, which is the cause of this. Next is glaucoma. Glaucoma normally is the increase in the intraocular pressure. You can see in the affected eye there are arrows. Arrows means that there is increase in the pressure within the eye. Usually the pressure increases in the aqueous humor as well as the vitreous humor and their problem in the drainage. It leads to optic nerve problems and then visual loss. What we can see is that there are two types: open angle glaucoma and angle closure glaucoma. In open angle glaucoma, there is obstruction of the trabecular meshwork and hence the drainage canal which drains the aqueous humor gets blocked. Hence it causes an open angle glaucoma. But in angle closure glaucoma, pressure pushes the iris against the cornea which blocks this meshwork and hence iris and lens get stick together. These are the two most common types of glaucoma which are seen in the patients. Symptoms usually are dull eye pain, slow loss of vision, tunnel vision, peripheral vision is lost earlier than the central vision, and difficulty in adjusting to darkness. Management involves drugs which increase aqueous outflow like miotics, drugs which decrease aqueous production like carbonic anhydrates, alpha receptors and beta blockers, hyperosmotic agents which help to release the excess fluids from the body, and surgical treatments like Aragon and diode layer trabeculoplasty or trabeculoplasty with or without filtering implant. Cyclocryotherapy to destroy the ciliary body can also be utilized. Last is macular degeneration. Macular degeneration is a very important problem which usually causes the loss of the central vision after the age of 60 years. We do not know the cause of macular degeneration. But there are many risk factors which are associated with it, like increased age, smoking, obesity, hypertension, hereditary, family history, and arthritis. It is of two types: dry or non exudative, and wet or exudative. If it is dry or non exudative, the outer layers of retina they break down. There is a loss of vision, there are blank spots, and the retinal pigment abnormalities and thinning may occur. If it is of wet type, there is abnormal choroidal neovascular network, there will be bleeding, edema, and fibrosis, which is not seen in the case of dry type of macular degeneration. So, these two are very common types of macular degeneration. Now, how do we manage the patients with macular degeneration? This also depends whether it is of dry type or it is of wet type. If it is of dry type, then no effective treatment exists. However, regular intake of vitamins and minerals help slow down the process, and also low vision aids may help. If there is a wet type, there is dietary supplement or antioxidants, vitamins and minerals may be provided. Photocoagulation therapy with the laser helps to reduce the leaking blood vessels. Dark eyeglasses and avoiding direct exposure to sunlight can also help. So in the end, let us summarize. We studied about 9 different kinds of vision problems and eye disorders. So eye disorders are associated with many kinds of risks. Nursing interventions are very important, which are helpful in treatment as well as care of these disorders. Education is the key. Patient needs to be told how to care for the eye, how to avoid anything which gets into the eye. So this kind of education to the patients is very important in caring for the patients and having a more residual effect of the vision left in their life. In the next session, we will study about the air problems and air disorders. So in this section, we have studied the various eye disorders, and with this, we complete the first section or the session of this teleconference. We welcome you to join the bouquet of programs offered by the School of Humanities, the Indira Gandhi National Open University, New Delhi. The Indira Gandhi National Open University, New Delhi is a mega university today. It was created by an Act of Parliament in 1985. It is the world's largest university with an enrollment of about 3.5 million current students and 3.2 million alumni. IGNOU has also been accorded the highest grade of academic excellence, A++, by the National Assessment and Accreditation Council, or the NAC. Now, during your time at IGNOU as a learner, we will help you complete your program of study with world-class printed materials, audio and video programs. We have more than 35,000 academic counselors who will guide you till you complete your program of study. We also provide live interaction with your teachers at the headquarters via teleconferencing mode, and live interactive radio counseling besides this, supported by regular TV and radio broadcasts. The School of Humanities was created in 1988, and we welcome you warmly to join any of our programs of study. IGNOU degrees, diplomas, and certificates are recognized not only in the country but are also very well received across the globe. We look forward to your journey with us, and we welcome you once again. Welcome to this session on nursing management of patients with eye and ear disorders. We have already studied a lot of disorders in the eye. Now we will continue with the disorders of the ear. Ear itself consists of various parts. There is the presence of the outer ear, the middle ear, as well as the inner ear. So today we will discuss about how the different problems occur in outer, middle and inner ear, and what happens as a nurse. How can we treat it, and what is the education points that we can give to our patients? So, introducing, we can say that ear is associated with the sensation of hearing and balance. Any problem which affects the ear can directly create problems with the hearing and the problems with the balance. Hence, one should be aware of this problem and how, as a nurse, one can care about these patients with the various ear disorders. In this session, we will discuss about disorders of various parts of the ear. The external ear disorders include otitis externa, cerumen or impacted wax and foreign bodies in the ear. The disorders of the middle ear include otitis media, chronic otitis media and mastoiditis. The disorders of internal ear, which include perforation of eardrum, otosclerosis, Meniere's disease and acoustic neuroma. Continuing to the first one, which is the disorders of the external ear. Number one is the otitis externa. Otitis externa is the inflammation of the external ear canal that may occur 2 to 3 days after swimming and diving. That is also known as the swimmer's ear. In the picture, you can see that there is infection in the outer air and there is a presence of a lot of drainage. This occurs in case of otitis externa. So, how do we manage this patient? We need to dry the air canal which comes in contact with the water or the moist environment. We need to avoid cotton tipped swab stick. This is very important because it usually causes the airwax to go inside rather than coming outside. So either it has to be used very carefully, or it should be avoided, and you can directly go to your physician, because it can force the wax to go up against your tympanic membrane and it causes further infection. So this has to be avoided. You can utilize a towel or a dry cotton cloth in order to dry your air canal. Alcohol is utilized to dry the moisture, acetic acid solution is utilized to restore the acidity, and antibiotics are used to curb any kind of infection. Corticosteroids may also be used because there is lot of inflammation in this case. A solution called as Burrows solution is used to decrease the drainage if it is caused by skin infection of eczema. Trained person should only be utilized in order to remove the debris from the air or do irrigation or suction. So always go to your air specialist to do that. Then the next thing is the curcumin, or also known as the impacted wax, into your air canal. Accumulated air wax does not have to be removed unless it becomes impacted and it interferes with your hearing power. Irrigating the air canal or removal with curette and suctioning can be done in some cases, but it only has to be done by your ear specialist. If there is a foreign body in the eye, in this ear, you can see in the figure there is a foreign body in the ear canal. A small round bulb is there in your ear. What happens is that if there is an insect, you can treat it by instilling ear drops to smother the insect, and then you can go to your health professional to remove it. Now usually insects are very common if you are living in tropical areas, or if the small children are playing in the field, then insects are a very common kind of foreign body which goes into the ear. Sometimes vegetables may also go into the air. The children sometimes dislodge or lodge peas or small toy articles into their ears. In this case, if there is vegetable, irrigation is usually not done because vegetable absorbs the water and it can wedge the canal. So in this case, always seek medical help. In any case, foreign body, you have to go to your eye or ear specialist or any kind of specialist, because it can lead to further damage if you use swabs or if you try to dislodge it yourself, because you're not a trained professional, and it will create further problem and damage to your hearing power. Now, if there is a foreign body, how do you manage it? Usually, unskilled person should not attempt to remove the foreign body because it may be forced into your bony portion of the canal. The canal skin may become perforated, your eardrum may become perforated. Once your eardrum becomes perforated, you may have hearing loss. The removal should always be done skillfully with the instruments. If the victim is very young, general anesthesia may be utilized in order to remove any kind of problem or any kind of vegetables or toys which are lodged into the ear canal. The next is the disorders of the middle ear. The most important disorder is acute otitis media. Otitis media, as simple it tells, otitis means inflammation of somewhere in your ear. If it is otitis externa, it means inflammation in your external ear. If it is otitis media, it means inflammation or infection in your middle ear. So there is inflammation and infection in the middle ear which is caused by the entrance of pathogens. There is presence of pain and the fever can go up to 40 to 40.6 degrees in Celsius, and there is a very high temperature. The patient may also complain of lot of pain and may not be able to sleep also. There is a pus-filled discharge. You can see in the figure there is a presence of problem in the eustachian tube which is associated with your ear, and there is lot of purulent discharge. This is also known as otorrhea. There is irritability, headache, hearing loss, anorexia, nausea and vomiting. The triggers, that is the risk factors, usually include history of upper respiratory infection, immunological defects, or head injury. One has to be very careful of ear infections, especially middle ear, in case of children, because the children can also develop tonsillitis as well as adenoiditis, which can be associated with the infection of your ear, because this whole canal is actually associated with one another. So one needs to be very careful, because an infection in the ear would surely give you infection in your upper respiratory areas. So this has to be very careful seen and managed as per the symptoms. How do you manage acute otitis media? The first and most important drug is the penicillin, and it is the drug of choice in case of adults. There is administration of nasal decongestants or antihistamines to remove any kind of allergic reactions. Surgeries may also be performed. Surgery usually performed is meningeotomy, where an incision is made into the posterior inferior aspect of the tympanic membrane for draining purposes, to relieve the pressure and hence to drain the pus, decrease any kind of pressure which is existing, and reduce the infection. Surgery which is performed is usually performed on only selective patients in order to prevent any recurrent episodes. If there is a failure to respond to any kind of antibiotic or antimicrobial therapy, such patients are also considered for surgery. Or if there is severe persistent pain, there is lot of conductive hearing loss, the patients are asked to go to surgery in order to reduce further hearing loss. What nurses can care for these patients include: number one, we need to administer the analgesics or aspirin as prescribed for the patient in order to reduce the pain and the pressure. Since I have told you that penicillin is the most important drug in otitis media, the nurses need to give penicillin derivatives or broad spectrum antibiotics as per prescription. And all the nursing interventions and consideration for penicillin must be taken into consideration. One must also utilize cold compresses over the ear if there is lot of pain and inflammation, because local cold compresses will help to decrease the inflammation and thus reduce the pain. Headache, slow pulse, vomiting and vertigo, because these are actually the complications, should be reported. One should be beware of the further complications, because this can go into your mastoid, your tonsils, and even your brain to cause meningitis and abscess. So this has to be dealt with particularly in an important way. Any kind of ear infection should not be just taken non-seriously. You need to go to your doctor and show him, because it is further leading to many complications. Now, further, what nursing care can you give is that, since the middle ear is also associated with the balance kind of thing, then it maintains the body balance. You have to be very importantly seeking that you have to prevent the risk of falls. How can you do that? The side rails can be picked up, calling for assistance can be done, and the patient can be helped out of the bed as well as for walking or moving from one position to another, because such patients will obviously have some kind of disbalance and will report lot of vertigo to you. They will have lot of giddiness, they will have lot of problems standing up also. So you also have to prepare the patient for the surgery if any, and educate them about the surgery. You have to tell the patient to avoid swimming, shampooing of the hair, showering till the healing occurs, and advise the patients on the hygiene. The next important disorder is chronic otitis media. Acute otitis media usually occurs immediately or has a short course of infection. Chronic otitis media occurs when lot of acute infections over the time cause lot of problems within your ear. It does not subside. It leads to chronic otitis media, and also can further lead to mastoiditis, that is infection in the mastoid bones and mastoid areas, and it is a chronic inflammation of the middle ear and mastoid which can exist up to 3 months. It is also very common in children, because they usually have problems with the ear and infections in the upper respiratory tract which can affect the middle ear as well as the mastoid. So there is also the presence of non-intact tympanic membrane and lot of discharge. It may be caused by antibiotic resistant organisms of particularly virulent strain kind of organisms. Now, what are the clinical manifestations? There is painless discharge. However, there is no pain, but it may have the smell or it may be odorless. There is a hearing loss. What kind of hearing loss it is? Air conductive loss. Then vertigo and pain because your central nervous system may be involved. History of acute otitis media or possible rupture of your tympanic membrane may be present in your patient. The mastoid pathology or mastoid involvement is seen on the X-ray. Then what kind of management can you do for such patients? We can do medical, surgical as well as nursing management. If there is medical management, antibiotic and steroid ear drops for infection and inflammation may be given. Removal of epithelial debris, purulent drainage to avoid the damage can be there. Surgery can be done when there is a cyst-like growth which is known as cholesteatoma. There may be pain, profound deafness, dizziness. So various kinds of surgery like simple mastoidectomy, which involves just the removal of mastoid cells, radical mastoidectomy, which involves removal of all the diseased tissue and the middle ear, and posto-anterior mastoidectomy, which involves combination of the simple mastoidectomy and tympanoplasty. So the whole middle ear can be restructured with the help of that. Now, what is the nursing care? You need to relieve the pain by either aspirin or codeine sulfate or cold compress. You should position the patient for comfort, antibiotics for reducing infection, sedatives in case the patient is restless, dressing changes daily or every other day. The packing is usually removed for third and fourth day, and nurse as well as the doctor, their team must be involved in caring for the patient as a whole. The other point is that always observe for possible complications which include facial weakness or paralysis, which may involve facial nerve injury, infection, vertigo, which involves the inner ear disturbance, and signs of meningitis. Because already I have told you, these infections can migrate even up to the brain to cause meningitis and further CNS involvement. You need to observe and teach clinical signs of the inflammation, like the clinical signs may be there, as well as fever may be there, purulent discharge may be there. This observation has to be frequently done. You should also note the status of hearing. As already told, there is air conductive hearing loss in these patients. So nurse should always evaluate what kind of hearing is there for the patient. If depends on different types of surgery, if your steppiece has been totally removed or dislodged, your total hearing will be lost. If steppiece or cochlea has not been removed, some kind of hearing power will be there, or the patient may regain it, and the hearing aid however may be required. So education about hearing aid, what kind of hearing the patient will have after the surgery, must be provided. Then we come to the diseases of the inner ear. First is the perforation of the eardrum. Your eardrum can be perforated. That is, your tympanic membrane may have a scratch and you will not be able to hear. It may be because of infections or trauma, which are the most common causes. Sometimes accidental perforations may be there. How can they occur? You dislodge something into the ear, and or you put a pencil into the ear and your tympanic membrane or your eardrum is totally lost. It can be also because of cauterization of the perforation with the application of prosthesis. In this case, the management involves you cauterize the perforation, try to seal it with the help of gel foam. You may also, there is also the presence of doing tympanoplasty, which is a reconstructive operation in case the middle ear as well as eardrum has been deformed or diseased. Now, there are various kinds of surgery which can be done. The number one is type 1 tympanoplasty, which is known as laryngeoplasty. In this, what happens, we try to close the perforation, we place a graft over the eardrum in order to close it. What care does a nurse have to give? She has to give antibiotics, dressing changes. She has to tell the patient to avoid the pressure on the dressing, avoid any kind of suction, and provide ear drops. What kind of education she does is that she tells the patient to avoid shampoo or showering till the total process of medicines is done. Provide the care, use antihistamines and the prescribed medicines to the patient, and tell how he has to take those medicines. Then there are various types of other, like for example, the type 2 to 5 tympanoplasty. So these are various grading. In the number 2, there is a graft and the which is against the incus or malleus, and the eardrum is usually replaced. In the third, eardrum is totally repaired and the graft is taken. In the number 4, eardrum is repaired and placed against mobile stapes. And in the number 5 kind of surgery, usually eardrum gets repaired and it is placed over a hole in the lateral semicircular canal and stapes is usually immobile. So your ear specialist will determine what kind of tympanoplasty has to be done for the patient. However, your management always involves providing antibiotics and suitable replacement for conduction sound pathway. You need to educate to reinforce the outer dressings if necessary. You also have to tell the patient to keep the inner dressings intact. Assist the patient in getting out of the bed for the first time because he might become dizzy just after getting the surgery. The next is the otosclerosis. It is a pathological condition in which there is a formation of new bone. You can see that in this a new bone has been formed, and because of this the stapes cannot move. There is a fixation, and when stapes cannot move, it cannot conduct the sound waves to your inner ear, and hence as a result deafness is created. It is a slow progressive hearing loss of the soft spoken tones without any known infection. The patient usually says that he has presence of ringing in the ears, which is known as tinnitus. How do we manage? Since there is no known cause as to how otosclerosis occurs, so this form of deafness, we can only use amplification with the hearing aid. Stapedectomy, which may be utilized to remove otosclerotic lesions at the foot plate of the stapes, may be utilized. You can also create a tissue implant with the help of prosthesis to maintain a conduction. What as a nurse you need to do? You need to observe for fever, signs of infection, headache, vertigo because they may point towards CNS or inner ear reaction, and pain. Position the patient post-operatively as told by your physician. Administer the prescribed drugs, be it pain, anti-motion or sedatives. Assist the patient with ambulation and instruct not to blow any nose because air can be forced in the auditory canal which can disturb your operative site. What do you need to educate? You have to advise the patient that there may be temporary hearing loss and there may be tissue edema and hence or packing which may be causing this hearing loss. Packing is usually removed by the surgeon 5 to 6 days post-operatively. Patient should protect the ear at all cost. You have to instruct the patient to avoid sudden pressure changes, not to blow the nose or fly in a small plane or dive or smoke, avoid any crowds or upper respiratory tract infections. Instruct to tell about any kinds of symptoms like tinnitus, vertigo because it may further tell you about complications. The next is Meniere's disease. It is a chronic disease, usually involvement of 3 important symptoms: vertigo, hearing loss and tinnitus. There is no specific cause, but one says that there is a fluid distension in the endolymphatic spaces which may cause a damage to the cochlear hair cells and labyrinth. There may be attacks of vertigo and hearing loss. During the attack, the patient feels dizziness, there is tinnitus, the headache is there, nausea, vomiting, and all the symptoms, and he may feel that the world is spinning around. But when there is no attack, there are no symptoms. So there are attacks in this disease of vertigo. How do you manage? Patient is usually told to keep a diary to note all the kinds of symptoms. Patient is also given vestibular suppressants to decrease the symptoms. Streptomycin may be used to destroy vestibular apparatus so that the vertigo can be controlled. Vertigo sedatives may be utilized to avoid it. Antiemetics to reduce any nausea, vomiting, and vertigo. Conservation surgery may be done, that is simple sac decompression or sac shunt can be done, or deconstructive surgery like labyrinthectomy or for the patients who have progressive hearing loss, or vestibular nerve resection in case the patient has any kind of vestibular nerve problems. What care can you give? You have to tell the patient to use protective and safety measures. During the attack, always be safe. Position the side rails up if the patient is in the bed, and if the patient is standing, help him down to the floor to avoid injury. If after the operation there is nausea, vomiting, vertigo, bed rest is the best thing to do. Assist the patient out of the bed since he may be unsteady, and for the safety purpose, have a call system or whistle system so that the patient is able to provide it with the assistance. Help patient recognize aura so that he has time to prepare for the attack. Employ the comfort measures, provide encouragement and understanding, remind the patient to move slowly since jerking or making sudden movements can cause an attack, avoid noises, glaring, and bright lights, which may also initiate the attack. What do you need to educate? Eliminate smoking, coffee, tea, alcohol, control environmental factors and personal habits. If there is allergies, you need to eliminate any kinds of foods or allergens. Periodic use of diuretics to relieve the feeling of fullness in the air or other symptoms. Inform the patient that the dizziness may last for varying lengths of time. The last disease is acoustic neuroma. It is a benign, slow growing tumor which develops from the balance and hearing nerves which supply to the inner ear, that is vestibulocochlear nerve. What happens is that there is overproduction of certain cells which are known as Schwann cells, which causes pressure over the nerves of hearing and balance and interferes with the facial nerves, muscles, and presses against the brainstem and cerebellum. Risk factors usually are the age, heredity, exposure to radiations. There are a variety of symptoms the patient may feel, which also include vision symptoms and the pain in face and ear. Usually what we do is that the surgical removal is done to remove the tumor and avoid any neurological deficits. The surgical approach may be through inner ear or behind the skull. The radiation is also taken care with the help of gamma knife. The nursing management can be done in case of patients with cancer if the special attention has to be given to allow communication and health maintenance with adjustment to the loss of sensation of hearing and complications. The important procedure, cochlear implant, is utilized as a device to emit auditory signals for the deaf individuals. It can be single electrode system or it can also be a multi-electrode system. There are variety types of cochlear implants depending on location of electrodes, transmission of signals, features of speech signals, type of electrodes, and the method of stimulation. So depending on the type of problem, the cochlear implants can be prescribed for the patient. Usually patient with the criteria of total hearing loss, which are shown on the audiological tests, physically healthy but there is a deafness, even these are utilized for children also, but patients should not have any evidence of brain impaired psychosis or mental retardation. These patients are usually taken for having cochlear implant. What we need to do as a nurse, we need to encourage them to talk about their problems. Pre-operative care is given and pre-operative examinations are done. After the operation of cochlear implant, we need to provide care for the patient just like a patient in general anesthesia. Rehabilitation has to be given within 2 months of the surgery, and also we need to tell the patient about the various adjustments, about listening, learning, discrimination of the sounds, and so on. Many individuals are trained with such an implant, can also lip read more easily and can distinguish between the voices and the environmental sounds. So, summarizing the various types of ear disorders, we can say that ear disorders are associated with many risks which involve hearing loss and the loss of balance. Nursing interventions help in treatment and care of these disorders. Education is very important to help the patients in the healthy recovery. With this, we come to the end of the nursing management of the patients with ear disorders, and hope you would have liked the session and would make excellent benefits along with your course material about this topic. So with this, we end. Thank you very much for being a part of the session.